Welcome, Ira Bel Santanlian and Donita Rose Cuevas. Welcome to our again. Welcome, Ira Bel B Santillan and Donita Rose Cuevas for our live lesson streaming via YouTube Live. Welcome, enjoy learning Mapeh. Pero Christian Katapang and Hannah, magsalita nga kayo guys kung nandyan kayo. Hannah Pastor and Pastor. Ayan, nag-out. For those who are listening right now for our YouTube lesson live here in YouTube, you can now type ready to learn Mapeh for your attendance. So lahat ng mga nandito na grade 9 na Del Pilar, please type ready to learn Mapeh for your attendance. here in our live session. So there you go. Luella Patria is in the house now. And also Beatriz Daniel Advento. Welcome to our live session, Learning Mape. And also Linus Alcor, Omay Ashana Celine. We have also Leona Rain Gutierrez is now ready to learn Mape together with Richmond Dongaol. Ayan. Also with George Santino Chan. Ayan. So nandito na ang mga grade 9 Mape learners. We have also here in the house now Beatrice Ann Galvan. Welcome, welcome to our YouTube live via my channel. That's Maestro Esong. Again, I'm Sir Philip Ramos welcoming you to our YouTube live session for our lesson for unintentional injuries, safety, and first aid. Welcome also to our live session. Again, Beatrice Angalvan, Bernadette Kate Fajardo. Again, for those who are here now, grade 9 Del Pilar, you use our live chat for you to drop your message and type now ready to learn Mape for your attendance. Again, welcome to our live session in learning Mape. We have here in the house Irabel B. Santillan, sorry, Luella Patria. We have Beatriz Daniel Advento, Linus Alcor, Ashana Celine Omay. We have also here Leona Rain Gutierrez, Richmond Dongaol, George Santino Chan, Beatriz Ann Galvan. We have also here now Bernadette Kate Fajardo. We have Bridget Lianda. We have also here Maria Christine Jernalu Siniel and Hannah Antoinette Pastor. For our simple house rule here in our live chat, guys, uh, iwasan lang natin na mag-type ng all capital letter para hindi tayo ma-invisible dito sa chat box. We have also here now in our live session, we have here Chris Sabayan, we have Christian Katapang, Elise Katakis, John Dexter Tahum, and Kim Ray Desacado. Welcome, welcome guys to our live session. Okay, for those who are here now, you're going to answer the first the first process question that we have here flashed on the screen. On your own opinion, what do you think is the best quality of a first aider? You drop your answer, guys, in our live chat box here. So again, for those who are here now, welcome to our live session discussing the things that we have already flashed on the screen. Let's take first unintentional injuries, safety, and first aid. Again, for the first process questions, guys, you answer it in by dropping your answers in our live chat box here. So, on your own opinion, what do you think is the best quality of a first aider? You tell also why you choose that best quality, guys. So, for the first one who dropped his answer is from Raymond Dungaol. He thinks that the best quality of a first aider is being readiness. Okay, so he dropped readiness. From Ira Bell B. Santillan, she says here, I believe that the best quality of a first aider is their ability to work under pressure. Okay, thank you for that, Ira. From Linus Alcor, to be able to perform first aid at any time and place, to be prepared for any possibilities and circumstances. So that's from Linus. And from Ashana Celine Omai, a skilled first responder must be able to recognize when someone requires immediate assistance. And from Hannah Antoinette Postor, the best ability of a first aider is their ability to uh, quick-witted. Yeah. And from Bridget Lianda, physically healthy and has knowledge on what he or she is doing. And from Luella Patria, communication skills. If you are able to communicate effectively with the injured person, they will be much more likely to trust you and feel reassured. Yeah. So most especially guys, if the victims are conscious, you can communicate well to them, comfort them, and of course, if most especially if you know the person well, most especially in their condition, then you could be able to render such immediate action towards their conditions. Most especially if in case of emergency, you can you can give all your all the things that you have known and learned from first aid. You can apply it, and from having these qualities, responding those particular situation, then you could be able to render quality service towards the victim. From Beatrix Ann Galvan, she says here that the best quality of a skilled first aider is someone who can control emotions and the ability to stay calm. Patients are typically nervous given their situation, so controlled emotions are important. Okay, so of course, the best thing that you can have as a responder, rendering immediate care to the victims, is to be stay calm and don't panic. Okay. From Elise Katakis, she says here that being able to communicate, who is always positive, will help you reassure the injured person and keep you from becoming mentally drained while dealing with the situation. So, mentally and physically upright person, most especially you are responding such a victim in an immediate situation. Okay, that is in time of emergency. And it is much important for us to be mentally and physically upright. So let's have now, before we are going to go with the main topic, which is the intentional injuries, we come first on to know about first aid here. So it says here that it is an immediate and temporary care given to a person who suddenly gets ill or injured, and it includes self-help and home care if medical assistance is not available or delayed. However, we must know the limits of the first aid we can give, because improper first aid can actually do more harm than good in some instances. So anyone who gives first aid is a first aider. That's why I ask you, what do you think is the best quality of a first aider? So let's have to know. We have here some important roles of a first aider. So it is a bridge that fills the gap between the victim and the physician. It is not intended to compete with or to take place of a services of the physicians, and it ends when the service of a physician begins. So of course, the first role of the first aider is there to respond such emergency. So in order to render immediate care prior to um, prior prior to the situation that the victim is being brought to the hospital for such services to the physician. Okay, so of course, first aid now ends when the service of the physician begins, because the physicians will be the one to render now advanced care, okay, for the victim. So we have here an objective of first aid. Of course, the first objective here is to save life, because we can prolong life by rendering first aid. Okay, and also to alleviate suffering. Of course, by having immediate care to the victim, we could possibly lessen in worsening the situation, and also to prevent further injury. Okay, yeah. So now we have here the characteristics of a good first aider. First one is be gentle. That make sure that does not cause more pain and panic. And that's why in calming ourselves and being calm in responding such emergencies, as your classmates a while ago state in um, their answers. Okay, that is to stay calm and don't panic. Second one is be observant. You are going to notice all signs. Okay, most especially if uh, fractures are being being experienced by the victim. Okay, we could not able to um, we could not able to render immediate care if we could not able to notice all the signs. Okay, most especially that is um, more often most especially if that particular injury is could able to worse the situation. Okay, so be observant in some other ways. So number three is resourceful, that makes the best use of the things at hand. Um, in case of emergency, we could not able to find things that we could um, able to fit with those such injuries, but rather being resourceful, we could able to make use of the things that are available at hand. Most especially, uh, you try to lessen the situation. So being a resourceful could be a greater help for you to lessen such situation in rendering immediate care. So the fourth one is be tactful. It does not frighten the victim. Rather, uh, you are there to comfort, most especially if the victim is conscious. He can listen. He can communicate. Of course, there are such situations um, that the victim is being trembled around. thinking of the situation. Okay, so we must be tactful in that particular situation. So again, do not frighten the victim. Okay, and the last one is sympathetic. That is comfort and reassures the victim. Reassurance means you are there to comfort the victim, tell the victim that everything must be okay. Okay, and reassure the victim also to stay calm, okay, and don't panic. Yeah, so we have also here principles of first aid, the do's and don'ts, and rendering first aid. For the do's in giving first aid, do stay calm, as we have here as the best, one of the best quality of a first aider. Do assure and comfort the victim. Do check a medical bracelet indicating a condition such as epilepsy and diabetes. Do loosen any tight clothing and do keep the victim covered to reduce shock. For the dons in giving first aid, of course, don't give food and drink to those unconscious person. Kasi yung mga unconscious person, they could not able uh, to grind food or to chew food, okay? And also to drink any kind of drinks because their condition is they are being unconscious. They could not able to respond in any related situation. So don't move an injured person unless you need to place him or her in the recovery position and self place. Just like for example, such fracture, we could not able to move the injured person because that is somewhat it being it might be worse in the related situations. Okay, so there are such relative ways on how we are going to put into the recovery position and safe place of the injured person or the victim. As it is being mentioned a while ago that we must be observant of the situation. In the principles of first aid, the survey of the scene and also the victims could be possibly applied. Number one, you're going to uh, secure and also survey the scene and the victims. Is anyone endangered? Move to the quietest area. Open the airway. Most especially kung merong mga nakikiisyoso dyan um, during the situation that occurs. Okay, we have to open the airways in order for the victim uh, to inhale air. Okay, to lessen the situation. So check for breathing also. Okay, there are ways on how we are going to check their breathing. Look for signs of circulation. Start cardiopulmonary resuscitation or the CPR to those who are knowledgeable enough in starting or rendering the CPR. Combine rescue breathing with chest compression. This is somewhat in in rendering advanced ways on how uh, to regain the situation of the victim. Continue rescue breathing also and check for signs of circulation in every minute. So that is one way for us to be observant all the time, most especially on the signs, vital signs of the victim. Okay, because we are there rendering such immediate care for the person to be uh, who are suddenly ill. So when we talk about signs and symptoms, when we say signs, those are details discovered by applying your senses, sight of touch, hearing, and smell during the course of the examination. Example, yung bleeding, swelling, and deformities. So those are the signs. For the symptoms, those are sensations that the victim feels or experiences and may be able to describe, just like nausea, vomiting, heat, impaired sensations. So that is the difference between the signs and symptoms. For primary survey, as a rescuer or as a first aider, we have to check for consciousness, conscious ba or unconscious yung victim, and open the airway, check for breathing, and check for circulation. That's the primary survey. For the secondary survey, we have check also, or yes, check the history taking, medications, the medical history of the family, allergies, last meal, events prior to what happened in area of pain. That's the secondary survey now. That those secondary survey could be able to take now for checking for vital signs for the physicians. Yan na yung kukunin doon. Or you re-render na for advanced medication. The pulse rate, the temperature, respiration, skin color, and physical signs. So we have here common unintentional injuries. So we have here wounds. We are going to concentrate first on the unintentional injuries. Of course, unintentional. This is not being intended to happen to such a person. That this might be happen through an accident, okay, and not being done intentionally. First one, we have wounds. We have here puncture, piercing wound caused by nails, needles, and other pointed objects, most especially those who are working individuals. Okay, just like those who are handling needles and handling nails. Okay, there are some incidents that might happen that even they are being used to it if they fail to have the proper handling, then they could able to experience such puncture. Abrasion that is being caused by rubbing or scraping the skin against the rough surface. Ayan, yung mga nababangga sa uh, mga pader. Just like for example, suddenly na yung impact ng pag rub or suddenly na nasagi ka sa isang pader na very rough, okay, then that will cause abrasion. Incision, that is a cut caused by knife, broken glass, or any sharp objects. Okay. Laceration, that is blunt breaking or tearing of soft tissues, usually resulting from mishandling tools and other accidents. We have also here avulsion, forcible tearing and or partial tearing away of tissues. We have here also fracture, that is a break or crack or in a bone. We have also here dislocation, that is partial or complete displacement of the bones. We have here sprain, an injury to the ligaments of the bone due to accidental tearing or overstretching. We have here also strain, an injury to the muscles which is being result of improper use of the muscle. We have also here heat exhaustion, that is caused by loss of salt and water due to excessive high temperature that may lead to heat stroke and even death. For food poisoning, of course, consuming food or drink that is contaminated with bacteria or viruses. Choking results when a foreign object blocks the throat. We have here water activity. We have also drowning, heart attack, chemical burns or burns, heat stroke, or even stroke. So those are guys the different unintentional injuries. Again, for unintentional injuries, those are injuries that are being um, not taken um, for such actions that are being intended to done to such person. Okay, most especially in harming the victim. So next meeting we are going to have okay, we're going to have intentional injuries. So to end up the session, guys, will you drop in our chat box what are the things that you have learned from this session? Again, in 1 to 2 sentences, let me know what are the things that you have learned in this session. Again, guys, you can now type your answers. Okay, so we have here first one to submit is Richmond Dungaol. Again, Richmond, thank you for learning Mapeh with us today. So, as you've stated here, you learn about the difference between intentional and unintentional injuries. That in intentional injuries happen when there's a motive to harm, while unintentional injuries happen when it is entirely accidental. Ayan. So here, Richmond could be able to determine the difference between intentional and unintentional injuries. How about the others, guys? Let me know who are who are still here up to the end of the session, aside from Richmond. We have here from Bridget Lianda, all about the difference all about the difference of intentional and intentional injuries. Ayan, Richmond. The different example and definition of what kinds. Ayan. We have here also from Arabel Santillan. I have learned the important roles of a first aider as well as their characteristics. So the principles of first aid, how to survey the scene and the victims. Okay, thank you for that, Ira. We have also here from Linus Alcor. What I have learned from the discussion from today are what is first aid, what are the main roles of the first aider, and the characteristics of a good first aider. We have here also from Hannah Antoinette Postor. A good first aider needs to be gentle, observant, resourceful, and tactful, and sympathetic. Ayan, yun siguro yung ano niya, yung dun sa first. And we have, you would also need to survey the scene and victims to ensure that you would give the correct type of first aid and they need. Okay, so that's the proper procedure. The things that are being absorbed by Hannah. Ayan, so from Bernadette naman, I learned from today's session is the first aid refers to the immediate care and to provide when a person is injured or while waiting till treatment is available. Ayan. Thank you for that, Bernadette. From George Santino Chan, I learned about the different kinds of common injuries and the characteristics of good first aider, the difference between signs and symptoms, and what primary and secondary survey is. Yeah. Okay, so for that, thank you, grade 9 Del Pilar, for attending for today's session. Till next learning session that we have in Mapeh, more particularly on the unrelated topics in music, arts, physical education, and health. Again, this is Sir Philip Ramos saying, let's embrace education in a new normal way and happy Mapeh learning with us. Till next time, keep safe everyone. God bless. Goodbye.